It is a pleasure to be here with all of you this afternoon, and I can tell you that I feel a lot better than I did this morning. When I got up this morning and read about some of the activity in Washington yesterday, I continued to be sad, heartbroken, and I would say a little depressed. Walking in here and seeing all of you makes it worthwhile for us to continue this fight, and it's critical that we do. I have the pleasure of representing the 8 federally qualified health centers here in Rhode Island who take care of more than 152,000 Rhode Islanders. That's more than 15,000. That's more than 15% of the population. Many of our patients, in fact most of them, are under 200% of poverty. And while a repeal of the ACA will impact everyone in this country, as always, it will disproportionately impact those with less. We have spent the last 4 years building comprehensive care for many of these people who were being seen either episodically in health centers or worse, in emergency rooms, where there was no continuity of care. And they were afraid to continue to seek care because they couldn't afford to pay for it, even in a community health center. We've had the pleasure of seeing our visits increase from just over 500,000 in 2012 to 630,000 last year. It's an incredible difference. The investments that the federal government has made in community health centers has been critical to the health of Rhode Islanders. We've seen better health outcomes, we've seen chronic disease better managed, but we've also seen those investments being made in communities. Because remember, community health centers are really about serving their communities. What we know is that when community health centers receive resources from the federal government, they continue to invest those resources in their communities. And so aside from providing incredible primary care, behavioral health services, and oral health services, community health centers employ Rhode Islanders. In 2012, there were 998 FTEs in community health centers across the state. That's about 33 primary care sites, and we have about 108 dental chairs across the state. In 2015, the number of FTEs had increased to 1,220. And in addition to that, community health centers built new buildings, renovated buildings, put people to work in the trades, invested in their communities. We need to be very grateful for our congressional delegation. This is a delegation that has supported community health centers. It has supported working people. They have been our advocates on health care and on a myriad of other issues. We're very lucky. Lots of my colleagues across the country don't have that kind of delegation to which they can turn in times like this, and who show leadership like this. We will continue to work with all the rest of you in this room to try and continue to make sure that our access to health care continues. We will continue to work with the delegation. We will continue to work with the governor to make sure that the people who are least advantaged in our society will continue to be able to have comprehensive care. So I'm really pleased to say that the Rhode Island Health Center Association has this week joined a new healthcare coalition, Protect Our Healthcare Coalition, that is going to be doing grassroots work to support the delegation and its work in Washington, as well as to support work here in the state. We're very excited about this, and we think that it will be helpful. So I am hoping that if any of you have any interest in more information, that you look at protectri@gmail.com, and we will look to continue to take this fight forward. Thank you. To introduce Congressman David Cicilline.